Okay, so the indirect skills part of the test, this is an invisible evaluation. So this is sort of going on behind the scenes. It's not part of the 3 skills that you're being tested for, but they're just making sure that you're going to do this on every skill. So this isn't a separate skill, but rather something that you're going to do with every skill that you're asked to do. The first thing is that you're going to make sure that you greet the resident by the name. So, hello, Miss Smith. My name is, Sam Goetz. I'll be your CNA today. It's really important that you introduce yourself by calling yourself your name, and it helps to promote this professional relationship and make your patient feel at ease. You're going to provide an explanation about care. One of the residents' rights is they have the right to refuse care. And how will they know that they want to refuse care unless you actually tell them what you're going to do? So whatever skill it was that you were given to perform for the test, you're going to explain that for them. You're going to ask about residents' preferences during care. So what you want to do is you want to give them a voice in their care, and you're going to work this into your care somehow. Standard precautions is if you are going to come in contact with blood or body fluids, you would wear gloves. So as an example, if you were cleaning the dentures or doing oral care, you would make sure that you put on gloves because you know that your hands would then come in contact with blood or body fluids. When you are taking somebody's pulse and the skin is intact, you know that you don't have to wear gloves because you're not going to encounter blood or body fluids. You're going to ask the patient about comfort needs during, before, and after care. If you're using a gait belt and one of the skills that you assigned are ambulating with a gait belt, you're definitely going to want to stop and check on them throughout. First, when they first stand up, as you're walking them, asking them if they're dizzy, if they have any discomfort. You're always going to promote residents' rights, so you're going to knock and ask permission before you enter the resident's room. And then you're going to promote safety during all the time during care. So an example of this would be leaving the bed in the lowest position before you leave the room. Here's a matrix that I've provided for you so that you can see what the evaluator is looking for specifically on each skill. So when they're ambulating, infection control, that's making sure that your hands are clean before that you perform the skill and at the end of the skill. That you're announcing yourself before you enter the room, that you're not calling your residents names such as honey, that you're leaving the call light. This is so important. The call light on every single skill. You'll see here, call light, call light, call light, knock, knock, knock. A lot of these are exactly the same for all of your skills, and you want to make sure that you're always including these. If you fail to do any of these, then you will fail the skill. However, if you notice, a lot of the times the skill set that you're being evaluated on is exactly the same. So you're always going to knock. You're always going to make sure your hands are clean. You're always going to make sure that the call light is near or in the resident's hand when you leave the room. And you're always going to make sure that the bed is in the lowest position. So this is the matrix showing you for each one of the 22 skills what those indirect behaviors that you're going to include when you perform your skill in front of the proctor. Again, if you have any questions or you need a little bit more help, I'd be happy to help you with some individual tutoring. But if you just study this chart, you study the videos that we talked about at foryourcna.com and see how Patty actually includes this in her skills, you should be able to do it. But if you run into a rough spot and you need a little bit of help, that's why I'm here, so make sure that you reach out.